Over the next 2 weeks, we're going to be doing head and neck, eyes, ears, nose, throat. We're going to break it up in 2 weeks. Today, we're going to do head, face, and neck. So what we're going to do is we're going to start out by examining the overall face symmetry of the patient. You want to look at the eye line to the ears. Ordinarily, the eye line and the top of the ear where it connects should be about equal. In patients who have fetal alcohol syndrome, or FAS, usually their ears are going to be lower. Also note any asymmetries in their face. One of the common ones you'll see sometimes is a lid that lags downwards. That's called ptosis, P-T-O-S-I-S. It's often a common sign of neurological problems. All right, next thing we're going to do is we're going to palpate the skull. So you can take your fingers and palpate through, back, and feel for any abnormalities in the skull. Once you've done that, you're going to palpate the neck. Two aspects to the neck. One is lymph nodes, and the other one is the thyroid gland. And you'll also note the general symmetry. So if a patient has a trachea that's pushed off to one side, two possibilities. One is a neck mass, often cancer, and the other one is pneumothorax, tension pneumothorax, where it'll be pushed away from whichever side has collapsed. So you can kind of put one thumb here, and look at symmetry. All right, for the lymph nodes, there's 10 lymph nodes for each side, and you're going to remember 3 of 3. So your first 3 is going to be starting in the back, occipital, then behind the ear, posterior auricular, in front of the ear, preauricular. So you went from back, behind the ear, in front of the ear. Next thing we're going to do is we're going to do down into this chin region. So just behind the jawline, turn your head this way a little bit, just behind the jawline, this is tonsillar. Underneath the chin, this is submandibular. And then the last one is underneath the chin itself, and this is submental. Submental, you only use one hand. So starting from the back again, occipital, posterior auricular, preauricular, then shift down, behind the jaw, tonsillar, under the jaw, tonsillar, and then submandibular. All right. Then the last 3 is going to be, turn your head again, this nice big muscle right here is called the sternocleidomastoid. So we're going to palpate behind it, and in front of it, or on top of it, and then deep inside it. So, if you turn your head back, so the first one is down this chain, posterior cervical chain. The next one is on top of the sternocleidomastoid, and that is superficial cervical chain. And then the last one is a little bit inside of that, and that one is called the deep or anterior cervical chain. Now the key on those is it's not one place. Here, done. You have to go down or up that chain. So some people go up, down, kind of like an N, and that's fine. Or if you want to start at the top, go to the bottom, start at the top, go to the bottom, that's also acceptable. The last thing is the thyroid. 2 techniques. On the final exam, final checkoff, you only need to do one technique. You don't need to do both. But I'm going to show you both for now. So the first one is from the front. You push the trachea to the side, and what that does is it bunches up the thyroid gland. Then you take your elbow and wrist, turn it over, show your sweat stains to the camera, and you're going to palpate off to the side. Same thing, push to the side, palpate to the side. The other technique is called the posterior approach, and you're going to throttle, what you're going to do is you're going to place your fingers on both sides of the trachea, palpating where the thyroid gland should be, and then you're going to ask the patient to swallow. Now, if your patient can't swallow, because what you do is you give them a sip of water. As they swallow, the thyroid gland will move up and down underneath your fingers. All right, so let's recap the whole thing. So we start off with inspection of the head and face. Palpate the skull, or the cranium. Then we're going to check for symmetry. Palpate the lymph nodes. and swallow. All right, now, for those of you who are paying attention, we skipped something. How many lymph nodes were there? Do you remember? 3 of 3 plus 1. So the last one is the supraclavicular. There's 2 ways to do it, from the front or from the back, and it's the same no matter which way you do it. So here's the clavicle. What you're going to do is you're going to go above the clavicle in the little fossa here, and you're going to feel to the side. As you feel to this, kind of rolling back and forth, you're going to ask the patient, take a deep breath, take a deep breath. And out. Same thing from the back. All it does is changes the angle that your fingertips go at. Some textbooks say to do it from the front, some say to do it the back. For me, it doesn't matter as long as you do it. And ideally, you do that along with your lymph nodes. Last thing, what should a normal lymph node feel like? Soft, flat, and non-tender. If you have a node that is enlarged or is fixed in position or is hard, that's not normal. If it's tender, that's also not normal. Now, most of the time, the 2 things that you think of with enlarged lymph nodes is you think of either inflammation, often infection, or neck masses such as cancer. How do you tell the difference usually between inflammation, infection versus cancer or neck mass? Do you know?
No, I wasn't listening.
So, if it's tender, chances are it's inflammation, infection. If it's fixed in place, it's not mobile, that's usually going to be more along the lines of neck mass or cancer. And that's pretty much it. Have fun.